Hello, my name's Danielle DeMone,
And I'm Kathleen Crowell.
and today we're going to be talking about mental health in Nova Scotia. Let's start with a bit of background on Nova Scotia's mental health. So the sector began to see changes after World War II. The number of mentally ill increased in numbers, and this encouraged the Canadian government to design a platform that is still used today, National Health Insurance. Grants were released to create buildings and train professionals to care for those that were mentally ill. In exchange for these grants, the mentally ill would be allowed to enter their care for no charge. Since the bare bones of the mental health sector started after World War II, science has shed a light on more mental health issues that weigh heavily on our population. According to Michael Pickup, Nova Scotia's Auditor General, the current mental health system in Nova Scotia lacks a province-wide plan for how and where mental health services are delivered across the province.
The research methods that we used consisted of primary research with in-person and online interviews with a doctor, a social worker, and nurses, secondary research on articles, provincial and national papers. Now let's talk about the problem landscape. Nova Scotia's government currently spends most of its budget on healthcare. The budget is not being spent wisely. Jason McLean from the NSGEU says that the whole healthcare system is in shambles. Jason is quite right in saying that our healthcare system is in shambles.
The World Health Organization defines mental health disorders as comprised of a broad range of problems with different symptoms. However, they are generally characterized by some combination of abnormal thoughts, emotions, behavior, and relationship with others. Examples include schizophrenia, depression, intellectual disabilities, and disorders due to drug abuse. Most of these disorders can be successfully treated.
During this report, we interviewed a licensed practical nurse named Samantha Mombaric. One of the things that she really came out and told us is that mental health has been an ongoing issue and something needs to be done about it sooner than later. I don't even think I could call it an issue. It's definitely more of a crisis. And she told us about a story about Kaylee Fox. So the shocking story that comes from the youth suffering from the crisis that Nova Scotia is facing is that of Kylie Fox. Kylie had been admitted to the hospital 3 times in 2016. Each time she stayed for a few hours and was sent home after the hospital. They said she was okay. She wasn't, because she committed suicide soon after. She was 21 years of age.
According to Statistics Canada, the age-standardized prevalence of the use of mental health services for mental illness among those of 1 year of age and older was highest in Nova Scotia, being 16.8%. Regardless of the location among residents, the age-standardized prevalence was 1.2 to 1.5 times higher for females than for males. The largest gender disparity was observed in Nova Scotia. 1 in 7, or approximately 5 million Canadians, use health services annually for mental illnesses. Women use mental health services more often than men, and the Classification of Diseases, 10th version, recognizes more than 400 types of mental illnesses. These illnesses range from being short-term to chronic.
Next, we're talking about prevention. Many mental illnesses can be prevented from an early age, but Nova Scotia's healthcare system does not provide the resources that are needed. The healthcare budget's aim is to provide care once these illnesses become full-blown. As of December 1st, 2017, 42,198 Nova Scotians are looking for a family doctor. The shortage of family doctors is a problem because those with mental illnesses can't get the care they need and instead go to the emergency room. In rural areas, finding a doctor is worse. One could wait 6 to 7 times longer than the city. On average, it takes 2 to 3 years to find a family doctor in Nova Scotia. Now, according to Dr. Chris Jenkins, He says, unfortunately, our system does not invest in prevention. Prevention has some high initial costs, with the savings later appreciated. Politicians who think in 4-year blocks are likely reluctant to buy into due to the high initial costs.
Nova Scotia's mental health systems are out of date. There are 3 areas that need to be dealt with, and those include prevention, how care is delivered, and our information systems and measuring success. As of right now, doctors are not interested in staying in Nova Scotia due to being paid unequal wages compared to other provinces. Nova Scotia's average doctor's salary is $250,000 annually, but in Ontario, this average is $350,000. Some doctors are actually being turned away. Mike McDonald from Island Family Healthcare stated, "We failed to recruit 2 young geriatrics to our area, even though Cape Breton was their top choice. Ultimately, it was their vision and our resistance to change that failed to secure their services, and not money."
We're going to talk about the solutions landscape now. We analyze the potential solutions and different groups that form part of the solutions landscape. Many organizations could be used to make a healthcare center possible that has a holistic approach to treating mental illnesses.
So let's talk about the Canadian government. Nova Scotia specifically has the budget to invest towards better mental health practices. They are spending over $200 million a year on mental health related costs, but there have been very few results. People are waiting hours at the hospitals to see doctors and are being turned away after only a small amount of counseling. Many patients do not have access to family doctors for treatments. The government needs to stop what they've been doing and invest in more beneficial practices. The funding needs to be invested in having more doctors in Nova Scotia that are focused on mental health. The lack of doctors is a root problem for the growing mental health issue. There are also solutions that other countries have discovered that the government should consider. Treatment centers and wellness spas are a fantastic concept that could be created and invested in within Nova Scotia. Nova Scotia also has grants that are available to non-for-profits or charities that aim to help mental health. The grants could be up to $100,000. If the treatment centers are run as not-for-profits, then they could apply for these grants. The other option is that the grant money could be used to subsidize the costs for patients going to treatment centers.
Moving forward, Nova Scotia needs to look at countries that are leading in the medical field. We researched 2 countries that have different healthcare systems that are international influencers for healthcare. Those 2 countries are Denmark and Switzerland. Did you know 100% of Danes have healthcare insurance where they're insured by the government? Citizens can pick between 2 insurance groups, and approximately 99% of the population is covered by Group 1. Group 1 is registered with a family doctor who belongs to the public health sector. They have free medical services from their doctor and specialists. A referral is needed if they need to see a specialist, except for odontologists, dentists, and ophthalmologists. They have low wait times for appointments and procedures if they visit a private hospital. In public hospitals, having surgery has lower wait times than here in Nova Scotia. Switzerland is another one of these leading countries with excellent healthcare. 99.5% of the Swiss have healthcare insurance, where they insure themselves. They are customer driven and have approximately 100 plus companies to choose from when they are shopping for healthcare insurance. They are the 3rd highest in the world when it comes to health expenditures per capita. They have low wait times for appointments and procedures. Health insurance plans in Switzerland go from primary coverage to high-end coverage, which includes medical spas. In some countries such as Slovakia, Switzerland, or Germany, financial support is even provided for medical spa treatments in other European countries. Swiss, for the most part, can go to any doctor they want. They have a free choice of physicians and specialists. They need no referral to access specialists. Swiss insurance doesn't cost any more than 10% of what they make and has adjustments for age and sex. Subsidies are in place for those that can't afford insurance. About 40% of the population uses a subsidy. The possibilities to incorporate the Swiss structure in Canada would provide the basis for a stronger Nova Scotia.
Now let's talk about treatment centers. They would consist of a period of 1 to 2 weeks of therapeutic, rehabilitative, and preventative procedures. Treatment would be offered to patients that are going through, but not limited to, anxiety, depression, PTSD, bipolar disorder, and other mental illnesses. The center would also provide crisis and emergency services. The treatment center would provide hospital and day activities to help with prevention. These activities would be a holistic approach to dealing with mental health illnesses. No matter what service a patient comes in for, a provision of mental health, health education, nutritional education, and prevention is included. There would be doctors and nurses on staff. The center would host a mental illness walk-in clinic powered by volunteers, graduate students, and one counselor for those that have an acute issue. Some treatments that could be available at the medical treatment centers include fitness expertise, yoga therapy, body scanning, medical consults, massage, blood testing, cancer screening, oxygen therapy, acupuncture, ultrasound, spa treatments, and hydrotherapy.
I'm going to talk about the relief for hospitals now. Did you know that 4 in 5 people are sent home a few hours after waiting hours to see a doctor at Nova Scotia hospitals due to bed shortages and lack of physicians? Just like in the case of Kylie Fox. A treatment center would take the pressure off hospitals and allow them to refer a patient to a mental health treatment center. Nova Scotia Mental Health Association would be able to refer patients to a treatment center instead of a hospital. A treatment center would help the IWK support mental health in children, with possibly preventing chronic conditions in the future. The Nova Scotian population would see a positive economic growth with healthier and happier employees in the workforce. A treatment center would lower wait times for patients to be seen, and one of the hopes of a mental hospital center would be to see a brighter future for Nova Scotians, resulting in fewer suicides per year. Let's talk about the way forward. For this to happen, we need to improve the system by exploring associations and programs that are seeking to help those with mental health illnesses. We need to advertise the available health care by improving knowledge, awareness, and increase the preventative knowledge on how to have a healthier mind.
Gaps that we found in our research include little change in exploring new ideas despite a strong case to act in reducing wait times. The current network of nonprofits and associations don't collaborate with the hospitals. The government hasn't been able to come up with a solution to this crisis. Some examples to counter the crisis would be increasing the scope of practitioners like nurses or bringing in international doctors, making it easier for international physicians that have already moved here to become accredited.
The increased demand on medical staff at hospitals must be balanced out by providing a proper facility to counter mental health. For Nova Scotians to move forward to a healthier mind and body, we must explore options like a separate mental health facility to prevent the distress of having nowhere to go. We hope after hearing both the problem and solution that you have a deeper understanding of the problem that Nova Scotians are currently faced with. The changes and support that is needed from the government to make these important solutions happen are critical.